next item of the agenda, panel discussion on common health issues, solutions in medicine. I now invite moderator Dr. B. Shashikiran Garu and panel speakers Dr. C.H. Mohan Rao Garu, Dr. D. Raghunath Rao Garu, Dr. C. Narsimhan, Dr. V.C. Rao Garu, Dr. N.V. Rayudu Garu, Professor Sundaram Madam, Dr. Sri Bhushan Raj Garu, Dr. M.A. Jalil Garu, Dr. Sunita Reddy Madam, and Dr. J.L.N. Shastri Garu to come on to the dais.
Thank you, and it's indeed a pleasure to conduct a panel discussion with a galaxy of doctors from different specialities and also scientists, Dr. Mohan Rao. And I may ask you a few questions and request you to respond and kindly use the mic because there's a recording going on and I'm told that this is going to be on the YouTube tomorrow. And most of the questions which I'll probably be asking you is relevant to the general public. And at the end of one round of questions, we will throw it open to the audience if the audience have also got any question. Maybe I will now start with Dr. Raghunath Rao. Dr. Raghunath Rao is a medical oncologist as he's been introduced to you. Dr. Raghunath Rao, the question I need to ask is, now of late people are feeling that the incidence of cancer is going up in the world, across the world and also in our country. And the second question of course is that the expenditure on cancer therapies is phenomenal, that it is almost becoming unaffordable to most of the population. Can you elaborate on these two issues, sir?
So the first question is the incidence of cancer really going up? Yes, of course it is going up, but the reasons for that can be a few, as I will elaborate. One, in the past, as you know, we had lots of maternal and infant mortality, nutritional poor nutrition and infectious diseases as the main causes of childhood deaths or early deaths in mothers. Once you control for food pestilence and famine and then take care of infectious diseases, that means you are going to grow into adulthood. So cancer in general is a phenomenon of aging. So the longer you survive, the greater are your chances that the multiple genetic problems which occur in the cell will add up to produce a cancer. Indeed, if you survive, say, beyond 85 years, you have a 1 in 3 chance of dying from cancer. If you survive beyond 95 years, you have 1 in 2 chances of dying from cancer. So the incidence of cancer in general rises with age. 2, an improved diagnostics. In the past, you just said the fellow died. We never attempted a diagnosis at all. We just said he died of old age or he died of some other cause, but we never investigated to find out what was the precise cause of death. But we now have a good plethora of tests from pathology, from imaging, from molecular testing or biochemistry to say that yes, this could be a cancer and the cause of death is possibly a cancer. So we have better ways of diagnosing and faster ways of diagnosing cancer than attributing. Third, yes, our lifestyle is contributing to a lot of cancer. This is the absolute truth. Just like how you get a diabetes, obesity, heart disease, or a COPD, which is a lifestyle disorder, so also cancer is considered to be a lifestyle disorder. So the same attributes which occur for any lifestyle disorder also are attributable to cancer. So the food we eat, the air we breathe, the water we drink, and our own general despondency towards an exercise or towards a good, healthy weight to height or weight to age and gender ratio, if you don't maintain, you're very much likely to develop cancer. Some more reasons are a dramatic increase, perhaps, in very many petrochemical compounds, of which I mean those which we use as pesticides, insecticides, herbicides, larvicide, pesticide, molluscicide, you name it. Any side you have, which finally ends up at the pinnacle of the food chain. Man is at the pinnacle of the food chain. So if you discard something as unfit for human consumption, but you give it to the farm animal, ultimately the milk it yields, the meat it gives, or the egg it lays is consumed by the human being. So ultimate consumer is man, and everything gets concentrated in you. And we know that all of them cause an endocrine dysfunction or disruption. So they're called endocrine disruptors in the human body, although they may directly not cause cancer. But we know that several of the compounds like plastics which we use, plastic generatives from petroleum products which we use can be carcinogenic. So that means we have now very many man-made carcinogens available to us. The famous example recently was the styrene gas disaster in Visakhapatnam, which both the industry and the governments tried to bury, perhaps over an understanding of a monetary nature. So if you bury such instances but don't go in a forensic manner or a long-term follow-up to see who develops cancer in the area where are the green, the red and the blue zone living there, or the yellow zone, you will end up with a disaster like that. Something like the Bhopal acid.
What about the cost of treatment, sir?
The next is the cost of treatment. Cost of treatment is a direct reflection of how do we indigenize the medicinal substances available to us. So if we indigenize all the branches of cancer care, you can bring down the cost. It depends upon the diagnostics. So we can indigenize the diagnostics. For example, you can get a construct from any of the PhDs from CCMB for a fraction of a cost of what is available in the general market. So if something costs $30,000 to have a construct for a molecular probe, you can do it for about 3,000 rupees in Hyderabad city. So that is as far as diagnostics is concerned. Drugs, yes, of course, if we can get away with the patency and declare them as for public good, yes, you can still manufacture all those drugs, but not just for India, for rest of the world. They're just like how we did the COVID vaccine in India, then the cost will come down.
Thank you, sir. That is wonderful. In fact, many of the biosimilar drugs which have now come up have actually brought down the cost by almost 100 times. That's how expensive it used to be. Now, moving from cancer, the linked one is Dr. Sundaram. I'll talk to you. You and I were contemporary pathologists way back in the 1980s. Our method of diagnostics was by using simple staining methods, and we used to have some special stains, and based on that, we used to diagnose diseases. Now, things have completely changed, and a pathologist is no more just a diagnostician. He also directs the clinician to treat. So, can you elaborate on the modern techniques in pathology?
Yeah. The diagnostic services have really evolved from what Dr. Shashikaran is saying. We used to do very simple tests, a urine test, a blood test, and a biopsy sample stained with routine stains. From that, now we have evolved into more and more precise diagnosis. That is what it is. We do immunohistochemistry, we do immunofluorescence. And from there, now we have moved on to molecular genetics to know the precise cause. What is the diagnosis? Based on the diagnosis only, the rest of the treatment will depend. From there, now we have moved on to a targeted treatment. That is, if you identify which particular drug can act on which particular thing, it is truly bench to bedside. That in between is the pathology or the laboratory. So whatever happens from the scientist in the research area, it is now translated into a patient care. So in between is the role of the pathologist, where we identify from a sample what is the actual cause, what is the disease, and to which drug it will respond, whether it is a drug, a chemotherapy or an immunotherapy or whatever it is. Or we identify an infection and we classify and subtype the infection, and then based on the pathology and microbiology and also biochemistry little bit, all these things, then we ultimately give a diagnosis either for an infectious disease, a metabolic disease, an oncologic disease, or a degenerative type of a disease. We are the key persons in the laboratory who will give that precise diagnosis, which can be converted into a patient care. So we have really come a long way from the routine simple tests that used to be pathology, which used to be a neglected area of the medicine, I should say. The clinician or the physician was glorified, but now the central role is taken by diagnosticians, that is the laboratory people. So they form the bridge between the basic research and the patient care. That is how we have evolved from the earlier days, or from what, when we have done our MD, that used to be the status at that time. But now we have come into molecular diagnostics and molecular genetics.
I remember our earlier days were much simpler and much easier than what it is now. Dr. Mohan Rao, you know that we just spoke about cancer treatment and also about diagnostics. And even the whole basis of both cancer diagnostics, also treatment, the new drugs which come are all based on basic modern biology. And can you tell us, you have yourself contributed quite a bit for many of the clinical conditions. Can you elaborate on what is the role of biology in medicine?
Yeah, role actually is chemistry. See, all our drugs that you take, if you have acidity, you take proton pump inhibitor. You have a blood pressure, you take beta blocker, calcium channel blocker, or receptor blocker. If you have high cholesterol, lipid synthesis blocker, something other you block. Use chemistry and block something or other. That has been the chemical method. If you block like that in a chain of activity, it is going to accumulate something. That accumulation will cause side effects. So this has been a chemistry-based drugs for all these years. Now the things are likely to change from cell-based therapy, from chemical-based therapy to cell-based therapy. In cell-based therapy, use stem cells or nanotechnology and 3D printing. All these things combination, if a liver is defective, replace the liver. Okay. You put another liver there. So instead of treating with the chemical these things, probably we'll move to cell-based therapy. That is one advantage which is happened. Second is DNA sequencing has become so cheap. Everybody can be sequenced. Now thousands and thousands of human sequences are available. We can also look for cancer genes, as you mentioned, and what are the genes which are present in any individual, which are any defective or likely to cause cancer. That's one level. Second, if a person is already diagnosed with the cancer, which gene is causing the cancer can be identified. You can go for precision medicine. Now the medicine has gone to precision medicine. Because of sequencing ability, we are able to go for precision medicine. That's one of the very strong advantage. And now the cancer treatment has become more successful. People don't die just because of cancer, because in the Western world, cancer is not like a death sentence. Okay? Many people, actually majority people survive because of this precision medicine availability and several other things like that. That's about sequencing. The new technique that has actually come to the world now recently is something called CRISPR-Cas technology. See, all this, whatever we talk about, if genetically you are inherited some bad thing, you are inherited with that bad thing. Only doctor can tell you, yes, you have this gene for so-and-so disease. We can do nothing about it. It's that your fate, you are inherited it. But with the CRISPR-Cas technology, even in your body, it can be repaired. We can go and correct the gene inside the body, because this technology is just coming up. People thought that it's a hype, but it's not. Actually, sickle cell anemia and thalassemia diseases. Sickle cell anemia happens with 1 point mutation. This is one of the earliest known disease, but still we have no solution for it, no treatment for that. With the CRISPR technology, it is possible to treat it. One thing is that human fetal hemoglobin is normal. Person who is suffering from sickle disease, his fetal hemoglobin is normal, but other hemoglobin is problematic. But fetal hemoglobin stops after 1 or 2 months of the postnatal thing. Now, if you can stop, why is it getting stopped? Because of a particular gene. Using CRISPR, you knock out that gene, or not knock out, you inactivate that gene. In that case, fetal hemoglobin can be continuously made. If that is made, you don't need to have any replacement. This is not an idea. It's been actually clinically tested. Clinically tested on a large number of patients. It will be made available for patients soon. Like Leber syndrome, there's a treatment available. For diabetes, also there's one approach which is now being developed from this CRISPR approach. So the CRISPR is going to dramatically alter many of these treatments, cancer, and every disease. One last point I want to make is that long ago, if your parents or grandparents had an ambassador car, that car is never thrown away. If a carburetor got spoiled, you replace the carburetor. Tires get spoiled, you replace the tire. Engine gets spoiled, you replace the engine. But the car remains. Okay, like that, in our case, your liver gets bad, replace liver. Whatever gets bad, you replace them, you probably live long. that may be futuristic, but that is not impossible. Yeah, thank you.
Thank you, Mohan Rao. And moving now from cancer to another very important area is on infectious diseases. Now we have here Dr. Sunita Reddy, who is an infectious diseases expert. Madam, I have two questions for you. Now, one is, you've been treating a lot of infectious disease, and over time you find that antibiotics are working less and less. Infections are becoming more resistant to antibiotics. And this is a big menace which is facing us, is antimicrobial resistance. So how do you as infectious disease experts are planning to overcome this? And the second question, of course, is now we also have I remember we used to have vaccines primarily during infancy and childhood. Now we are getting a whole set of vaccines for the elderly, the senior citizens vaccines. So what do you think are the meaningful vaccines which we should advise for our public as far as the senior citizens are concerned? So these are the two things on which I need your expertise.
Thank you. So the first question is about antimicrobial resistance. Now, Dr. Mohan Rao Garu just told us about using chemicals for diseases like diabetes or high blood pressure or lipids. When you're talking about infections, we try to kill other living beings. There's a difference between trying to treat a disease where you're working on chemicals and when you're trying to treat disease which we're working on other living beings. Now remember, humans, we are a small number of people, living beings in the planet. Microbes by far exceed by billions. Now, what we've learned back in school, all living beings undergo multiplication, replication. So as these microbes multiply, they also develop mutations. That's normal course of life. Now, when you have put an antibiotic to kill the microbes, now microbes are by far smarter than humans, way too smart. You use a chemical to try to kill a bacteria or a virus. Now what are they going to do? Survival of the fittest. They develop skills by which they can survive. Basically the mutant strains which can outlive the chemicals that we are giving to kill it, make them survive. So whatever you do, we are not going to be able to win the battle on microbes. We started off in the good old days penicillin. Now we hardly hear the word penicillin or tetracycline. We talk about meropenem, colistin, huge drugs. Now, all of these medications obviously have side effects. Now, how are we going to beat the microbes? By avoiding exposure to the antimicrobials. You avoid antimicrobial exposure, automatically you don't encourage the replication, survival of the mutant strains. They may go back to the wild strains which are more susceptible. So if I have a cough and a cold, the first thing I do is go to the pharmacy, give me an antibiotic. I have a cough that's not gone for 2 days, give me an azithromycin. You just go ask the pharmacist for an azithromycin. Cough and a cold is commonly either allergic or viral. Why do you need an antibiotic? By using an antibiotic, you're promoting drug resistance because you're exposing the bacteria. Now, whether I have whether it's a virus or a bacteria, now my body is full of antimicrobials, full of bacteria. Now, some bacteria are going to develop resistance. So that's one way. Second is, again, like how we talked about animals industry. We give antimicrobials left and right in the animal industry to promote growth. Now, that is a huge place. What human beings use antibiotics is a small number as compared to what we use in animal industry. So we need to kind of stop that use. We need to encourage people to avoid buying poultry or buying meat that have been exposed to antibiotics. That will hopefully make the farmer avoid using them. So you need to educate the people, you need to educate the farmers, and you need to have guidelines. You need to have strong, strict rules where you don't use antibiotics as growth promoters. And one other example, Hyderabad is one of the most important states or places where we have industry for pharmaceuticals. So when you're using, when you're developing drugs, so how are these drugs discarded? If you're going to produce more and more antimicrobials and you're going to discard them into the waste, or if you're going to use these antimicrobials either in humans or animals, and if you're going to discard them into the waste, they're going to go into the sewage system. Now, sewage system has plenty of bacteria. So today the problem is, I have never used even if I have never used an antibiotic, and I come to the hospital, I'm seeing the patients come with drug-resistant bacteria. Why? Because there's so much of antimicrobials in the system. Our sewage, for example, has drug-resistant pathogens, and we obviously will be getting those same pathogens because they're in the community. So all of these reasons, we are having a lot of drug resistance. So one, instead of trying to solve the problem by creating more antibiotics, prevent resistance is one major thing. Of course, we do have to come up with newer antibiotics, antimicrobials. There are very few newer class of antimicrobials today that are being investigated. Now, we talked about coming up with more and more research, right? Now, if I have diabetes, I take a diabetic medication for the rest of my life. So or if I have high blood pressure, I take the blood pressure medication for the rest of my life. So the company that makes these medications have an incentive to make it, because I can make medicine that a person XYZ will take for the rest of their life. So I can make money out of the drug. Whereas if with the antibiotics, I make a drug that I'm going to give for 4 or 5 days, and then this doctor is coming and saying, don't use the antibiotics. Now, why will the drug company make the drug that is not going to give them money? There's no return on investment. So here, countries have to invest money into research towards antimicrobials. We are coming up with not just drugs, we're talking about using other ways to treat. For example, if I have some kind of an antibiotic-associated diarrhea like a Clostridium difficile, there's technology that we use something called fecal transplant. Because your gut microbiome is altered, we're trying to change the gut microbiome by giving feces of another person into this person, so that my microbiome is normal, and then that will take care of my infection. Then there's something called phage therapy. A lot of newer technology is coming, again, for personalized treatment to determine what is the resistance for that particular bacteria to treat. So if I have a particular drug-resistant bacteria, that can be you can find out a particular treatment just for that particular bacteria, not for everything else in the world. So these are in the pipeline. Hopefully in the future we will see. And most importantly, prevention of infections, which comes to your next question about vaccination. Now we talk about vaccines in children. Children obviously need vaccines. We all know about it. Now if you look at the history, we've kind of evolved significantly in terms of decreasing infectious diseases. Now, a lot of this decreasing infectious diseases is not because of antibiotics or vaccines, if you can think of it in one way. How many children have you taught when you were younger? You were always worried about, okay, my child is going to get a diarrhea, or children are dying of infections. Now, all of those have gone away, not because of medicines, but because of improved sanitation. Now, you can control infections by improving sanitation. Except for, of course, polio, we've used the same reverse technology where we gave oral polio vaccine and used the problem with sanitation to create a herd immunity in the rest of the population. But so we have come a long way in terms of infections, and vaccines play a major role because we can prevent diseases. Now, for example, we give children vaccines, BCG, DPT, MMR when they are born. Now, as you grow older, your immunity wanes away. The immunity that you take, the vaccines that you take in childhood, that immunity doesn't last for the rest of your life. So today, what we are seeing is adults developing those infections. I can get pertussis in an adult. I can get measles in an adult. So adults need booster doses of these, and these are there in recommendations in international guidelines, but are not being implemented as a government-sponsored program in the country. These are something that you need to be aware of. And We also should remember, now we talked about COVID and COVID after, post-COVID, people are dying of heart attacks and strokes. Now, infections can lead to other comorbidities like cardiovascular diseases. For example, pneumococcal infections can lead to cardiovascular diseases. I have a higher risk of dying of heart attack in the 1 year post a pneumococcal infection than a normal person. So I can prevent these infections. Pneumococcal infection causes lung infection, can causes infections in the heart and the brain. I can prevent this infection by giving a vaccine. But we don't think about vaccines in an adult. So if you need to talk to your doctor and see what are the infections that you need to get treatment, prevention from. Influenza, pneumococcal infections, these are very important for people who are elderly or who have other comorbidities like diabetes, high blood pressure, or neurological disease, kidney disease, liver disease, all of these things. Recently, we are seeing a huge outbreak of typhoid. Now, typhoid is something that we've all have heard about all our lives. Typhoid, there's an indigent vaccine. India has come, Indian-made vaccine, typhoid conjugate vaccine, which is an excellent vaccine. Now, how many of you in this room has taken a typhoid vaccine? I don't think anybody is, most people are aware of a possibility that you can take a vaccine to prevent typhoid, and every time you have a fever, you say, okay, I have typhoid and I take antibiotics for that. These are preventable diseases. Shingles, very debilitating disease. You have vaccines for this. There's a lot of vaccines available for adults, and these need to be treated. And if you can prevent these infections, you will not give antibiotics for those diseases, as well as you will prevent non-communicable diseases as well. So vaccines are very important. So it's a huge topic by itself, but it's something that you need to talk to your doctor to see what is indicated and take the appropriate
Thank you. I
vaccine.
think we'll have to bring in a public awareness that even adults need to take vaccines, because the people think that it's only children. Now, moving from you, I would like to address Dr. Narasimhan. Dr. Narasimhan, now the general public know a cardiologist as a person who manages heart attacks and stenting and etc. But you are an unusual cardiologist, a world-renowned man who looks at the rate and the rhythm at which the heart beats. And you are concentrating mostly on cardiac rhythm abnormalities, and you are a cardiac electrophysiologist. Now, can you tell us what are the rhythm abnormalities which can occur, and how a patient can actually anticipate and go and seek help with a cardiologist if it is a irregular heartbeat?
Heartbeat can be relatively very benign, meaning very simple, commonplace on the one end of the spectrum. And the other end of the spectrum, it can seriously kill a patient. It can cause sudden cardiac death. In fact, the commonest cause of sudden death in the community is because of a rapid heart rhythm called ventricular tachycardia or fibrillation. So the normal heart, which is supposed to pump at about 70 or 80 beats per minute, it generates a sufficient amount of blood flow to the rest of the body. But if it starts quivering very rapidly, it doesn't generate any pulsatile force. It just quivers like this. And that's called ventricular fibrillation. And that can be lethal. The good news is it can be prevented. By recognition, there are certain high-risk indicators where you can diagnose and treat the patient. The earliest warning in the community is a benign faint. A person who suddenly drops to the ground and wakes up after a second or two, you call that as a faint. If it doesn't wake up, it's called sudden death. So the difference between faint and death is only retrospective. Most of the common faints are because of vagal phenomenon. They are common. But for starters, if you have a person who's fainting again and again, or who has had a injury following a faint, that's a red flag. You need to investigate this person further. Second thing is a person with a prior cardiac disease. If he has had a faint, that's a serious problem, because at one moment in time, the heart failed to generate enough blood flow to the brain. It was a brief period. Luckily, the heart started pumping again, and therefore he is alive. But if it failed for a brief period of time, if it's more than a few minutes, the brain is permanently damaged and you have a brain death. And therefore, for a common man, the benign faint needs to be investigated further, And every person where there is a fluttering of the heart, rapid beating, nowadays curative treatment options are available, they can be investigated.
Thank you, sir. This is again an area where people are not familiar. People are aware of myocardial infarction, angina, and things like that, but that the heart irregularity can also kill you is people are not aware of. Thank you. Now we move on to another cardiologist amongst us, Dr. Raidu. So, how do you recognize heart problems and what age group is affected by heart disease? And what's the present day treatment of heart diseases and how do we prevent heart disease?
Thank you very much, the organizers and the audience and sitting on the dais. See, heart disease, a fearful disease. Everybody fears about sudden heart problems, sudden events of heart, and sudden cardiac death. The suddenness is the major issue in heart problems. It strikes like a bolt from blue. Actually, it doesn't come on but like a bolt from blue. It is because of our lifestyles and of course aging. Aging is one of the commonest problem a man faces, a population faces because of the development of heart disease or a cancer. But nowadays, youngsters are also getting involved. Why this is happening? These are all called lifestyle disease. The lifestyle disease usually is due to uncontrolled hypertension, diabetes mellitus, smoking. Of course, in India, smoking is receding. Very few people are smoking nowadays, luckily. And increased cholesterol, the bad cholesterol, this is called LDL cholesterol. The things we eat and the amount of lack of physical activity, all these things produce bad cholesterol more and good cholesterol, that is called HDL cholesterol, is less. Both these combinations, bad cholesterol is getting high and good cholesterol, HDL, is getting low, produces heart blocks. Sudden blockage in the blood vessel. What happens, heart is a pump. It pumps blood, but it also needs some blood for oxygenation and some glucose for its proper working. So when it is blocked, the vessel gets blocked, the heart pump weakens, and also because of vessel is blocked, the patient may complain of uneasiness in the chest, discomfort, burning sensation, and it comes. Most often it is a little severe, but sometimes it is not very severe also. And another important issue is this heart blocks happens between early morning and late sleep. That means heart attacks are more common between 4 a.m. to 11 a.m. because of several reasons. Of course, there are scientific explanations for why heart attacks are more in the early mornings because of the increased sympathetic tone, becoming suddenly active from sleep, and also increased blood coagulability. All these things produce sudden blocks in the vessels. When heart block is there suddenly, the heart pump becomes weak. So patient complains apart from chest pain, he also feels breathlessness, giddiness because of the less blood supply to the brain. He feels giddy and may feel weak also, and there will be profuse sweating. All these signs are signals of heart disease. So this is an emergency situation. When heart vessel gets suddenly blocked, this is an emergency situation. He has to attend the medical team with proper facilities. And what is the first test? Simple test, electrocardiogram, ECG. It was invented in almost 120 years back, but still one of the best diagnostic tool. So after taking ECG, the specialist will decide whether it is a major heart attack or a minor heart attack. If it is a major heart attack, the blood vessel has to be opened completely, immediately. It is an urgent situation. So there are several facilities available to open up this vessel. So all of you know balloon treatment, balloon angioplasty with stenting. Balloon clears the blood, clears the block, and also stent improves the blood flow and also maintains the blood flow after the balloon is dilated. So improving the blood supply is the first step where facilities are available. Where facilities are not available, of course, there are some medication which are available, like lytic therapies, which lyse the clot. And among them, the commonest is streptokinase, urokinase, and the little costly medicine is Alaxim, that is tenecteplase. So all these medicines are available and tremendous developments are coming on, but still the cardiology practice is still very expensive treatment, and the patient has to reach the hospital on time. Time is very essential in these situations. So as early as possible, the patient has to be carried to hospital and immediately has to be admitted and also the moment somebody has chest pain and taken to emergency room, the first response to all our attenders is anxiety. They feel anxious and then don't listen to the doctor also many times. First listen to the doctor, understand the doctor, and try to follow his advice, and so that the expert will give you best treatment. Of course, as I told, the heart disease is a disease of aging, no longer. Even young people are getting affected. Why it is becoming like that? Lifestyles. We are buying the heart disease by our lifestyles. Hypertension, diabetes mellitus, smoking, stress, lack of exercise, sedentary. We are lazy people in general. We should not be lazy. A lazy person is more bound to heart problems than an active person. So to prevent, we have to control these risk factors so far. Identify these people who have these risk factors and try to control them. Control diabetes, hypertension, avoidance of smoking, decrease the LDL cholesterol level by statins or by lifestyle measurements, and good exercise. Daily do some exercise, physical activity. Stress, another important factor that is affecting our health. We are living longer. I don't know whether we are living better. So one has to be very careful. Our lifestyles are different. Earlier people used to be more peaceful. Smoking was more those days, but heart disease was not that common. Why it is happening? Stress, lack of exercise. These are the important risk factors. And diabetes, obesity, another important risk factor. So modern treatment is they're ever expanding. Cardiology, heart disease treatment is increasing day by day, every day. In these 40 years, I have seen the tremendous developments in cardiology treatment. But cost is also increasing. And also, if you have a disease, not only you should have, you should go to hospital, but you should have enough finance to meet the hospital expenditure. That is the first important issue in cardiology treatment. It's a very expensive treatment.
I should actually got an insurance guy also on the panel. Because everything amounts to the cost of medical treatment, isn't it? Prevention is much less expensive, absolutely.
Prevention is not very expensive. Yes. Main thing is, if you look at it, simple thing is, this was repeatedly emphasized, just cutting down sugar and sweets in the diet, cutting down that extra pinch of salt in the diet, avoiding the chips and the pickles in the diet. These are very, very simple things. In nature, there is nothing called sugar. Our intestines and liver is not meant to handle sugar. Similarly, when we eat in animal kingdom, the next 2 days, 3 days, the animal will not get a feed. So it takes the calorie and stores it in the liver. It's not breakfast, lunch, dinner, breakfast, lunch and dinner. The human biology is not meant for that. That is why every single religion, whether it's Lent in Christianity, whether it's Ramzan or Amavasya in this, periodic fasting is a very, very simple way of preventing this catastrophe. You would have seen your parents, grandparents, 2 days in a week they'll fast. Just nothing, just 10, 15 minutes of yoga in the morning or some kind of peaceful meditation, whatever you call it, so that you are ready to face the day, whether it's a bad traffic or a very irate customer or anything that is going to shoot up your blood pressure. You are prepared for the day. And a little bit of physical activity, a little bit of change in diet, and a healthy attitude will go a long way, better than any health insurance. Because we have listed a lot of treatment options. The commonest reason why people don't get the right treatment is because most of the events happen during sleep. The patient doesn't wake up. My heart attack happens at 11 or 12 midnight. I'm dead by the time in the morning. The most expensive treatment next door doesn't matter. So prevention is the key. Again and again we are seeing, because the CEOs, CFOs, we have seen the misdiagnosis after 3 days, 4 days, they come later. So if there is one message we want to say today, heart disease or cancer, whatever it is, it's too expensive to treat. And it's far better to prevent this, and prevention is simpler, less expensive, if only you put your thought to it. And there are a lot of societal changes which need to be done. I think Dr. Raghunath Rao did mention, lot of it has to come from the environment, the air we breathe, the lung spaces we have, the water we drink. It doesn't need to be, I mean, the water that lies in the lake for 10,000s of years is bottled in this and then sold as not used beyond 3 months or 6 months. It has been there for thousands of years in the lake. And so we need to think of these basic things. And if you look at Scandinavian countries, they don't spend a huge amount of health on health, but their environment is pristine, the air they breathe is very, very good, and the perceived sense of security. Suppose I'm an 80-year-old person, I fall and I have a fracture, who is there to take care of me at home? The perceived sense of security, that there is a society to take care, I belong to that society, that is enriched in some of these countries, and that makes a huge difference in patients' well-being.
Thank you. Raghu, a brief comment from you.
Yeah, sometime back we did an analysis of lifestyle and lifestyle disorders in relation to Swagruha foods and the mother spoon feeding Chaitanya and Narayana students. So if you look at the increase in obesity in urban conglomerates in India, it was about 6 to 8% in the 1960s. It is now a staggering 65% of adolescents are obese. The contribution is only threefold. One, the ready availability of fast foods. Many people think fast foods means the McDonald's burger or a pizza. No, all your Swagruha foods are fast foods. Most of you don't recognize this. They are very readily available. You need to stand in a queue to buy them by the ton. People are buying them by the ton, not by a 250-gram packet. Second, the mother is, and of course later the wife, are spoon feeding. They are shoveling food into the Chaitanya Narayana child, who is studying from 5 a.m. till 10 p.m. and beyond, with zero exercise. None of the schools have a playground ever. They have never heard about it. Okay, so the child is actually becoming obese right at adolescence. So the foot into the grave is started by the mother overfeeding a limited pancreatic capacity child. So that is how it starts. And what is she shoveling? She's shoveling everything which is available there.
That's true.
That is when it starts. So prevention starts there, not later.
Physical activity thing, there was a study which compared how many calories we'll burn when we sleep and how many calories we'll burn when we are awake. In the 60s, if you take the basal metabolism at sleeping as 100, it used to be 160 during the wake hours. Now it's only 120, which means we are only burning 20% more calories during the day compared to the time when you're sleeping. And so what happens to the rest of the calories? It sort of adds up, isn't it? So you are talking again about respiration and all that, and I'll go back to Dr. Vivek Dr. Vivek is a pulmonologist and an occupational therapist. And I know many years ago, Vivek and I fought the case of one employee who had asbestosis and mesothelioma. And the case went up to the Supreme Court. And I remember we provided evidence and got the worker the compensation. I still know that how much you are dedicated to the health of the workers. Now, can you elaborate on what are the occupational hazard and what is it you are doing for occupational therapy?
Matra Devo Bhava, Pitru Devo Bhava, Acharya Devo Bhava, Atiti Devo Bhava. At the outset, let me tell you that Dr. B.C. Roy was a family doctor for B.M. Birla family, and Brijmohan Birla, or B.M. Birla and B.C. Roy were very good friends. They used to call each other by first names. Sir, I will be speaking on occupational health and it's how it can make India as a Swasth India. Occupational health is a subject related to the occupation. Every individual has got some occupation or other. It is not just restricted to the factory workers, mine workers. It is health of each individual working in offices, IT professionals, scientists, politicians, administrators, everybody has got their own profession, and including homemakers. So each profession has got its own risks. This subject's first reference, as per the latest literature, refers to Bernardo Ramazzini, an Italian physician in 1670s or so. But India is always first. It is the 400 BC work, Kautilya's Arthashastra, mentions about miners' health. Kautilya was a visionary, and when he was allocating budget on health, he has divided health into three subjects: general health, sanitary health, and miners' health. General health, we all know what is general health. But for preventive aspects, he has created sanitary health, providing safe drinking water, safe drainage system. See, that was his vision. And for miners' health, he said that there are particular group of persons, by working, they are prone for certain diseases. They are earning money for the government, but they are suffering. So he has allocated separate budget for them on prevention, compensation, treatment. So a visionary has to be there in every subject. And all occupational health problems are preventable. All occupational problems are preventable. They are prevented by best of personal hygiene, occupational hygiene, and following the recommended work practices at the workplace. If you follow them, we can prevent all the occupational diseases. And occupational health professional, they just do not limit themselves to preventing occupational diseases. It aims at total health of the individual. All his health issues has to be addressed. And the main components of this occupational health are not only health surveillance, but health education and research are the most important issues are there. So why I think that a good occupational health system everywhere, either in hospitals or offices, can prevent all health issues when employees are educated about prevention of lifestyle diseases. I just take, because occupational health issues are preventable by proper environment controls in the workplace and taking precautions. But nowadays we are facing lifestyle disease problem. I am the first person, maybe in India, sir, you will have to correct me. In 1982, I have screened my population, 2,000 workers. When I found 60% were tobacco smokers, I have recommended to the management to prevent lung cancer. We had to prevent tobacco smoking in workplace. And my management agreed. They talked to the employees, and we have implemented ban on tobacco smoking at the workplace. And we have made it a pre-employment condition. That must be the commitment to prevent lifestyle diseases. Afterwards, I did certain things. Now, my new target is overweight. We have been talking overweight. Those who are having BMI more than 35, I do not make them medically fit for employment. I have that freedom in in my organization. So when employees are educated about prevention of lifestyle diseases, they will share the knowledge with their family members. So, so the more and more number of people will be educated. Thus, with good occupational health practices, we can achieve Swasth Bharat. So, Sarve Bhavantu Sukhina, Sarve Santu Niramaya.
Thank you, Dr. Vivek. In fact, talking about occupational health and occupational hazards, I want to tell you a study which we did at the National Institute of Occupational Health. They found many temple pujaris actually have chronic lung disease, primarily because they are inhaling a whole lot of agarbatti smoke and other oil burning smoke, and there's no ventilation. Many of our in the temples there's absolutely no ventilation. So there's the occupational health spreads across every kind of occupation in our country, and we have not paid enough attention to each of this. Thank you very much. Extremely interesting one. The next big problem which our country faces is chronic kidney disease. And we know that you will notice that the number of dialysis centers in our country have gone up several fold, because there are more and more kidneys are failing due to a variety of reasons. Again, going back to lifestyle, diabetes, hypertension causing end stage kidney disease. And I will now ask Dr. Sri Bhushan Raju, who is a nephrologist at NIMS. Now, is it possible to prevent these kidney diseases, and when to start such methods for those who are vulnerable to kidney diseases?
Thank you, sir. Thank you for the question. And it has been already reiterated by the previous speakers that the prevention, and the prevention of every disease, be it a cancer, be it respiratory disease. Children and young adults coming to us with the kidney diseases, which are actually preventable if a proper antenatal care is given to them, especially the preterm deliveries. And those who are born with less than 2.5 kg and all, they are vulnerable to get into kidney disease later. And not just the kidney disease, if the preterm child is given proper care, they can prevent hypertension, diabetes, any kind of a disease later, including the kidney disease. And the proper screening is very, very important. Unfortunately, kidney is a disease where manifestations are less, and they come to us very late in their clinical course. They come to us within a few months after before the kidney disease is declared as end-stage renal disease and requiring dialysis and transplantation. So it is very important for us to have a screening for the young adults as they grow, and especially those who are vulnerable. I can name them something like the patients who are diabetics, patients with a high blood pressure, patients who have a family history of kidney disease, and the patients who have got a family history of premature atherosclerotic disease in the form of a stroke or a coronary artery disease, and those who are having a treatment for any long-standing disorders, something like skin disorders and joint disorders and muscle disorders. Those who have been taking a lot of drug therapies, they should be screened regularly. And the prevention states at every level, something like a primordial prevention, primary, secondary, and tertiary. So it's better not to take drugs unnecessarily, as advocated by Dr. Sunita about the antibiotic therapies. And I also advocate not to take analgesics, also the proton pump inhibitor, antacids. People have been taking a lot of antacids, proton pump inhibitors like omeprazole, pantoprazole, esomeprazole, and all. These are also the drugs which can really damage the kidneys subtly. So it's very important, and also to quit smoking and not to be obese. And obesity is also one of the risk factors for the development of hypertension, diabetes, which are the main culprits in developing kidney disease in the age between 30 to 40. So the children, then the adults, elderly population, those who are having a coronary artery disease and the strokes, they are more vulnerable to get into kidney diseases. And also the drug therapies, several infections and the stones. There are so many belts are there in the country where the kidney stones are very common, leading to kidney failure. Not only that, the farmers and also the laborers who have been working in the outside under the sun and getting exposed to the heat, they are getting into heat stress nephropathy. And there are some pockets of areas in the country where the people are getting into CKD, kidney disease of unknown etiology. And this is also one of the things which can be prevented if proper screening is done. So prevention of any disease as such, that including the kidney disease, should take place from in utero, and then only we can make a healthy nation.
Thank you, sir. I remember we did a research study in the one district called Udanam in the Andhra Pradesh, where there are a lot of CKD cases come, and we did the analysis at NGRI.
Yes.
A lot of silica was there in the water
Yes.
sources, and because of the mountainous terrain there.
Yeah, there are several areas, pockets in the country also where the CKD is getting into prominence because of the high prevalence in the particular locality. But as such, it's increasing in the prevalence, like the way cancers and all, the way the longer they live, the more cancers. The longer they want to survive, they want to live more life, they have more cardiac diseases, and the longer they want to, and again the kidney disease also of unknown etiologies actually. So we should be able to prevent right from the day one.
Thank you, Dr. Raju. And now we have all talked about modern medicine, but many people do know that there are several promising therapies in our traditional medicine, which is Ayurveda. So I will now address Dr. J.L.N. Shastri. How can Ayurveda bridge the gap in the management of lifestyle disorders?
Thank you, Dr. Shashikaran. I'm glad to start with. I was thinking probably I'll be sitting here as an odd man out, but most of the panelists are talking about prevention. As we all know, our expenses at the personal level, at the national level, even by the government, are more on the medical care, not on the health care. It's a simple calculation which we normally forget. We are ready to spend more and more on medicine. We do not look at health at all. Unless and until that kind of an attitude comes back, it's really going to be a problem. It's not the question of system, it's the question of what you call a healthy life, what we need to have. Many conditions what we all have discussed are dependent on only one thing. Like in Ayurveda, way back in 500 BC or 2000 BC as we believe, 500 BC as what the Western world believes. Ahara sambhavam vastu rogascha ahara sambhava. We are all born like this, like the other panelist was mentioning about the birth weight and the disease. It was mentioned and pronounced by Charak. You are like this because of the diet which your mother has taken during pregnancy. And today, look at it, a pregnant woman is treated as a patient. That's where the problem starts. Pregnancy is a physiology where you do not have normal deliveries. That's the first point. That means we have not taken care of the mother. Okay? And coming to the child, we keep giving them the vitamin supplements, iron supplements, calcium supplements. Okay, when I was part of Government of India, thanks to Mr. Ram Mohan Mishra, the then Secretary WCD, who introduced Poshan Vatika. We had a discussion, and I said, how many years you are going to give these vitamin supplements? It is 75 years. You are feeding them without any proper result. India is still having highest number of women suffering from your congestive cardiac failure because of the iron deficiency. And we don't speak, we are pseudoscientists, we don't speak about the non-availability of proper iron salt. Do we have a properly chelated iron salt from any pharmaceutical company? No. We have done a lot of study on that. But still we are feeding the public with these kind of iron salts, knowing that it will be excreted in the stools. A calcium, if you give 1 gram of calcium, hardly 400 mg will be assimilated into your system, and we don't know what rest is happening. And we know in Western countries there are a lot of studies giving side effects. We are happy with that. Are you really going to become nutritional literate? We are illiterate as far as nutrition is concerned in this country. So these are all things which have been embedded in our ancient tradition. We always speak about what is good and what is bad for the health. And Ayurveda has gone a step ahead, and he has given 8 dimensions of life, not 4 dimensions of life. What is good and bad for good and bad? What is healthy and unhealthy for good and bad? Okay, all the components have been given. If properly introduced back into your healthcare system, not into the medical care system, we have sufficient, what you call, foods which are otherwise superfoods today. We are working for the superfoods. No? When we were looking at the alternatives, I give few examples. Methi ki laddu. In North, people take methi ki laddu. And jal jeera and all. Do you know, sir, even your Anand literature suggests they are rich in two food ingredients which are rich in vitamin B. Okay? All the B complex are there in these two. And we have not realized this. We have not brought it back into our system. We are going for pizzas. We are going for your chow meins and pastas. What not everything. Even I was part of WHO food for medicine. Food as medicine, sorry. Food as medicine. There is a forum of WHO which is seriously working on making food as drug. Otherwise, we are starting with molecules and ending with molecules. Majority of the conditions can be treated by looking at your gut microbiota. In Ayurveda, we have a classification of entire disease, what you call spectrum, into two categories. Gut, upper part of the gut and lower part of the gut. That means your Indian medical science could recognize the importance of gut microbiota and divided the diseases into two categories. It gives a huge scope for the research, and maybe the coming generation definitely may get a Nobel on this concept. Like your circadian rhythms, in Ayurveda, we talk about dinacharya and rucharya, the circadian rhythms. And circadian rhythms, you got a Nobel. And in Indian herb, you got a Nobel on malaria. Okay, Artemisinin. So, if you really get focused, no system is a full-fledged kind of system when it comes to the healthcare. I really appreciate the kind of advancement we have. Like Nageshwar was absolutely right. On the medical care front, especially your emergency care and surgical conditions and your infectious diseases, as rightly mentioned, we are par excellent. But coming to even infectious diseases, there are certain what you call herbal constituents which are really helping in the MDRs. Okay, so if you bring all these things on one forum and put it into practice, again, back like what you were doing, all the Indians were not dying all these years. The mortality rate may be high in certain cases, but the health index was high. So that's exactly what we need to look at. Bring back the dietary habits, like rightly mentioned about fasting. Langhanam paramoshadam. Okay? That those concepts, simple concepts, which you need to bring into public health. Again, I don't want to bring it into medicine. Bring it into public health, identify the role, and put it in practice. Like India is probably the only country in the world which is involving in the medical graduates into primary health care. If you look at the WHO concept, when they developed the primary, secondary, tertiary, and if you look at the practices across the globe, probably India is only using its forces more and more in the primary care. And that's another problem probably. By bringing in the primary health care into the fold of your traditional systems of medicine, you are going to use these forces for the other conditions. This is more apt for one reason. On 19th of April 2022, India got the Global Center for Traditional Medicine to India, which is a significant development for us, and we have superseded China to bring it here. So it's our responsibility to join hands and maybe introduce these principles again into practice.
Thank you. I think I will add to what you said. If anybody reads Bhagavad Gita chapter 16.1, 16.2 and 16.3, in Bhagavad Gita it is said, a person who cannot control his cravings, who cannot eat within his limits, who doesn't sleep well, who doesn't move about, cannot do his regular duties. So that is what was said, and you can go and refer in Google, it'll be there. So thank you so much, sir, about the wealth of traditional knowledge, and you are doing a great job by, by your cultivating many of these traditional herbs for the medicine purposes. Now we'll come to Dr. Jalil. You're last but not the least. There was a recent report that said that 80% of the people across the world have back pain at some time or the other in their lives. And the second thing I wanted to also tell you is the question of people still not wearing helmets to prevent head injuries. And these two are one of the major contributors to the neurological problems which are seen in the country. And again, a huge waste of expenditure, and both which are preventable. So your take on this?
It is said nearly 80% of the patients and many of the people stop going to work for a few days because of backache. So this backache has becoming a huge problem, not only in India, throughout the world. This is again because of our sedentary habits and not doing exercises. And as Dr. Raghu had said earlier, kids who go to the schools from morning 5 to 10, they're hardly exposed to sunlight. So most of the backaches, in addition to their mechanical backaches, because they're abnormal postures, software engineers sitting with abnormal postures, children sitting in the school with abnormal postures, younger people started having these backaches in the recent. And as I repeat, Dr. Raghu had told about the kids going to school morning 5 to 10. See, I had a child, a teenager who was 17 years, who was playing in an international school, playing all sports, was hale and active. The moment he stopped going to these schools and going from morning 5 to 10, in the last 6 months before he came to us, he had got 6 MRIs done of his spine. All MRIs were normal. Doctors have been telling him not required, but every time his parents in their anxiety get an MRI done. MRI spine is normal. And then we get his metabolic profile done. We get vitamin D levels. Vitamin levels are less than hardly 6. The normally should be 30 to 100. This hypovitaminosis causes backache. And once, in fact, we had to tell his parents to get him back into regular school and all that. He started playing his sports, he started playing football, his backache disappeared, and he did well in his education also. These are the basically causes of backache. Other than this mechanical and metabolic causes, of course, age with spondylitis, they can have backache. Some small disc problems can cause backache. But severe backaches can be in patients with other tumors or a large disc. But most of the patients with backache can be managed conservatively with physical therapy. They really don't require any surgical intervention, even if there is a disc. Most of the 95% of the disc patients can be managed with medical treatment. And in addition to this, we are also having neck pains also, especially the software engineers who are sitting on the system for a long time, looking at the console for a very long time. So they need to take some breaks whenever they are sitting from morning to night in front of the system, at least 15 to 20 minutes. They should move their neck right and left, or about 20 minutes. After 30 minutes, at least they should get up, walk a few steps, and come back and sit at the system. So these preventive steps can prevent their backache, either low backache or the upper part of the back. Coming to the trauma, the number of trauma cases are increasing tremendously. One is because of increasing traffic, increased number of vehicles, and the number of vehicles with high-speed vehicles that are coming to the market, especially bikes, and people not wearing helmets. So whenever they don't wear a helmet, and especially with the high-speed vehicles, they fall, they can cause severe head injuries. So one of the basic things to prevent trauma on the roads is always wearing helmets all the time. Number 2, follow the proper guidelines. Of course, the lane system is very difficult to follow in our country because the lanes are not. Then, of course, talking on phone. In fact, what I find is more than now, the problem is talking on phone is not so riskier rather than actually texting on phone. While we are driving, either a car or bike, rather than we look at the WhatsApp messages, or we try to text while driving the cars, or we try to make a call. In fact, I feel while that driving and talking is not so risky as texting and driving. And then other thing is we see so many unworthy vehicles on the roads, hardly any brakes, no lighting system, and then ego. Ego of the driver is also very high. So especially when we see, when we walk, when we drive, when we
Ego or arrogance?
no, ego. Ego also. Because especially when I am driving, a lady overtakes me.
Yeah, you get
I do not accept it. So let us say, there's a fact. So we try to overtake that vehicle. So in that process, we do a lot of mistakes. And many a time when we do that, we are aware we are doing a mistake. But we think we'll escape that and do our work. But that can cause a lot of problems leading to trauma. Both head injuries, more than head injuries, these traumas can cause spine injuries. At least most of the head injuries are treatable. Spine injuries, if they have any paraplegia, if they develop, what all we do, throughout the life, the patient will paraplegic and the bed. So spine injuries are also becoming much more frequent because of the high-speed accidents.
Thank you. Thank you, sir. I think that's a lot. I'd like to conclude by adding a joke. It seems the joke said that 150 years ago, batsmen in cricket used to wear abdominal guards, 150 years ago. But it was only 20 years ago they started wearing a helmet. That shows they realized the brain is more important only recently. So anyway, this has been a wonderful discussion, sir. I enjoyed every moment of it. And can we take some questions from the audience? I hope none of you are in a hurry. We have another 15 minutes so audience can ask questions, but please be brief and be very precise, and you tell also who you are addressing it to. And please provide a hand mic to the person asking question.
Sir, it's actually not a question, but the advances which is happening, how really it was an enlightening panel discussion. But each one of you have always come back to prevention than the treatment which has to come forward. What I came across in the research recently is on sensing much earlier exosomes for lysing them with, and also a nanotechnology protein break, which we could make a breakthrough for breast cancer at IEST in Trivandrum. And it has a huge potential that it is not going to the labs for diagnosis, but you can do it at home. The reason is if you are able to convert this from antigen or antibody to aptamer. And this can come down the cost to less than 100 rupees. If it is so, now I'm trying to encourage more startups to take up this. And the ICMR has cleared for the breast cancer. Now we are working for, they gave us a target for pancreatic and lung cancer. So this is one step. Maybe people like you should advise the concern that how we can take it faster, because that potential is there in the country. In a very short time, we could do this. Then, yeah, okay, I'm Krishnamurthy. I'm not a doctor, basically. I've recently come from an Institute of Space Science and Technology, where we had to look for, when we send astronauts to space or people to space, we also had to look forward about their health and other related. That's how we are interested in making this research in that area. That's how I'm talking on this subject for flow. While coming to the next is on how we can give more awareness. What I found is even in the heat stroke, sunstroke, what we get. Most of the time the scientists speak. In Telangana, maybe in 2018 or 17, we tried the doctors to tell what to do through the satellite communication network. We connected our transponders to the normal communication link, and every house who has a time on which it has been given the advisories by the doctors on what is going to happen in the next 2 days in terms of the sunstroke. And that helped. That year there was no deaths by sunstroke in Telangana. That's for your kind information. But these kind of things, like we have the Academy of Science and Technology and Communication, and the inputs what you're all giving is enormously good, but how it goes to the public, that's one which maybe the Academy for Science and Technology and Communication. But the another one which I heard is on our exhaling of gases. There's a combination of gases which can detect what type of problem can come in any part of a body. And that's a new method of, but only for detecting, we need to make a spectrometers or etc., which can find out that combination of the compounds where we can detect the diseases much earlier. The reports tell in the next 5 years, most of the people will having one or other type of problems, but will be in a position to exhale, use it as a measure for analysis, and then early detect, so the problem for medication also will become, the cost of medication also will become less. Maybe these are the some thoughts I thought, because you are a multidisciplinary team sitting here with all the facets of medicine, maybe you can answer. Thank you.
Can I respond to that?
Yes, sir. I think Mohan also will respond.
Yeah. The problem is not about the early detection part. Let us say I have a test which can detect any cancer or any disease for that matter before it manifests 6 months or 6 years or maybe 6 decades before it is going to manifest. What do I have as a preventive treatment for that? So the problem is always very simple. Diagnostics outpace therapies by about 2 to 2 decades. Let us say I did a test for a woman and said, you are likely to develop a breast cancer. Your genomics from the blood or I can measure some tumor specific DNA in the breath or the blood or the urine. Doesn't matter, whatever is the area from where you did the test. Now, what do I have to offer to that woman as prevention or treatment? So if I can't prevent, if I can't see the disease, I can't remove it. So if I can't image that disease, I don't know which breast to remove, which part of the breast to remove. If I still continue to remove both the breasts, that means I have done something stupid like Angelina Jolie. She thinks that she has prevented BRCA associated breast ovarian cancer syndrome. No. The nipple line runs from the anterior axilla all the way to the groin. The entire thing is called nipple line. If you see any quadruped, you will know what the nipple line is. That means most animals will have twinning or quadruplets. Triplets or quadruplets only. That many number of puppies a bitch will produce. So it will have that many number of nipples. So it runs from the front of the axilla all the way to the groin. So all along the nipple line you can still get a breast cancer. So it is not a way of preventing breast cancer at all, although the surgeons love to do it. So if I can image, if I can see, then I can offer a treatment. Or I should have something at a molecular level to switch off that gene. So probably there, Professor Mohan Rao can help us. But just earlier diagnosis than what treatment can be offered as prevention is not going. It will just raise the anxiety of it. So I will tell you of a small example. We had a old lady of ovarian cancer. When her daughter developed breast cancer at the age of 35 years, I did BRCA 1 and 2 testing. And lo and behold, yes, she had BRCA 1 positive. So I went back and did it to her mother, BRCA 1 positive. I did it to all her sisters, BRCA 1 positive. Agreed. I did it to all the brothers, BRCA 1 positive. The problem was with her children. So she had a 1-year-old boy and a 3-year-old autistic daughter, okay, who live in the US. So how do you counsel the autistic daughter that you have a BRCA1 mutation positive? So the lady died of breast cancer because the disease progressed before we could do anything. She came pretty late to us. The mother lived to see that she could not counsel her grandchildren. She had many grandchildren and we could not counsel them. So what's the point in making an early diagnosis at a chromosomal level if we can't offer something as... So the anxiety level in the whole family shot up. They were a family of about 26 first and second and third generation family. So all of them are very anxious now. So you will only create a panic reaction in the family. Who is going to marry them? What's going to happen to their employment? Who is going to insure them? Nobody will do it. So it is easy for us as medical people to offer a test or a scientist to discover something, but if we don't have a solution to prevent it or to treat it, then we are not doing any justice to that sort of a test.
Dr. Sundaram also wants to say something.
Yeah, what he said is practicality, that if you are told that you have a defective gene and you're going to get a disease and we are not going to do nothing about it. It's not going to be any better. But that's not the case today. Today, for example, BRCA1, BRCA2 mutations are found on. Now, although it's not yet available clinically, we can use CRISPR to correct that. Either mutation can be silenced or can be repaired. In the laboratory, these experiments are done, but not yet onto the human being. So soon enough, we'll be able to identify a genetic based disease. If there's a gene for a particular disease or mutation for a disease, it can be handled in time. Maybe right now not, but it will be handled. But also in one principle is that diagnosis early, if there's actionable possibility, it's definitely going to be useful. If there's no actionable possibility, it's certainly not a good idea. When you're comparing to the antibodies versus optomers, antibodies and optomers both actually specifically go and bind to a particular target for recognition. Antibodies can be raised in animal. That is not very expensive, although the companies make it expensive. Optomers are easy to synthesize once you develop. Of course, developing optomer, cyclic process is very long, very complicated. But once you know optomer, making them synthetically is very, very cheap. That is true. Optomers will be useful for diagnostic purposes, and people are already, as you mentioned, many startup companies are trying to use optomers for detection. Of course, optomer is only binding. You have to visualize it. Visualization is another part that, of course, that can be taken care of, but that is going to happen. But I still want to go back and say that the early diagnosis is definitely going to be useful in any medical context. But if there's no actionable thing at all available, then maybe, as you said, the tensions will build, unnecessarily will create a complications, and then may not be of great use.
But actually, Dr. Mohanrao, if you look at this early diagnosis, many early diagnoses like PSA, routine mammography, are all now being stopped. Because they're saying they have not done anything much to prevent the disease. Yeah. So there is, unless it is clinically indicated, many of these early diagnostic, as Raghu said, create problems for the patient rather than give them a solution.
No, that what I said actionable. If there is an actionability possible. But again, PSA also is true. Screening for general public is not a good thing, and it's stopped. But PSA high value, people have PSA high value, percentage of people who are developed the prostate cancer are very high compared to people who have a less than certain lipid. So it is still going to be useful, but not as a public screening.
Sundaram will bear out on me if you were to do autopsies on everybody will have a prostate cancer beyond a particular 60 years. So Sundaram also make a point, and then Dr. Narasimhan.
I agree. I think there is another side to the problem. Early diagnosis is important for most of the sample on which you can work and other things. It will give you an understanding of the pathogenesis so that it will be a basis to develop a drug. If you know what is going wrong at what step, you will be able to prevent it. It may not be helpful to the immediate patient or their sibling or a child, but that is the basis to do research and develop what can be done. We have done autopsy on a case of Alzheimer's disease, one patient with Alzheimer's. Then the daughter, then they asked, how likely are we to develop? She wanted to donate her brain when she dies. Okay, she wanted to contribute it for research and other things. At that time, there was a lot of discussion with our neurology colleagues. They said, what are you going to do with that? If we say something, it will be that the daughter is likely to develop something or they have something. Then it will only increase the anxiousness that I am going to develop, I am going to lose my memory. That kind of a thing will be there. That's what the neurologist has opined. But the doctor and daughter was very positive. I'll donate my brain for research purpose. At least if you know that it can be familially transmitted or something, it may not help me because I already have whatever are the defective genes I have. But it will help for the future research. So if you understand these kind of samples and studies, if you know what is going wrong, what is the underlying pathogenesis, that is the basis to develop new drugs where we can prevent that this thing or develop an effective treatment. So it is just not, even if I diagnose, I am not going to do anything for this patient is not the full stop. It is an ongoing work into understanding the disease process. So
That's a
that is
very
what we
valid point. Dr. Narasimhan?
I just want to add one more. Like Raghu mentioned that imaging is the one which is obviously absolutely important. That is true. For example, if somebody is genetically or molecular level is exposed or likely to develop a disease, let's say breast cancer, and these people can periodically or certain time points go for imaging. So you may be able to catch that image very small level so that your chances of survival will be very high. If you have not done this test, you left it and you go to the doctor only when it's too big, then survival chances are very less. So the early diagnosis is going to be useful, but this actionable part is to be taken care. And of course, anxiety, other issues are there. That is definitely there. But early diagnosis scientifically and technically would be useful if you can use it appropriately. And doctor may have to make a decision whether it is okay for this particular family, particular case is useful or not. But early diagnosis per se would be certainly useful.
Yeah, Narasimhan? I think once Dr. will end this discussion, I think we are running out of time and
Right.
Dr. Narasimhan.
Thank you for because we are always talking about two things. As a physician, it's important to realize body is a whole. For example, if a person has irregular heartbeat, there are very effective drugs to suppress the irregular heartbeats. Very effective drugs. Molecularly, they have acted on the channel, they have worked very well, but ultimately it increases mortality. The patients die more often. Similarly, aggressive control of your blood sugar in diabetes, that came as a beautiful concept, but ultimately end result, there are higher number of deaths. So it's important for a physician, the organs don't work in isolations, they crosstalk. You need a holistic physician to look at the whole picture. There is a limit to reductionism. We go on going on. If you do one thing in the heart and the renal blood flow goes up, the GFR declines, of what use is it? So it's important to try these knots together and look at the ultimate outcome, as was rightly pointed out, because there's a huge hype about diagnostics, about this. But if I say that simple prevention is far more beneficial, it never gels into the patient. But believe me, the benefit is far, far greater than allowing a disease to appear and then treating it. That is the reason why we are harping on this again and again, because you can do a lot more by simple measures. And these things will not be advertised. You won't see it in Google because there's no company to advertise. There's no sponsorship for that. If you say drink clean water, breathe good air, good exercise, and good attitude, there is nothing to sponsor. Whereas if you say there is a huge amount of industry behind a drug or imaging, diagnostics, treatment, but the benefit doesn't equate the same thing. For example, if you had prevented Titanic from colliding, that captain would have never been in the news. If Sully was not there, never landed the plane on the Hudson River, he will not be known. But I would like to have a pilot who would have seen the air and said, look, it is unsafe to take off. Don't take off. There are too many. That is the true role of a physician. The physician puts everything together and prevents a problem, is the unsung hero in modern medicine.
I just wanted to elaborate on the recent, very sensational news that Tata Memorial Hospital has created a molecule which prevents cancer. No, it doesn't prevent any cancer. So it was there in the newspaper. Then they had to call back Dr. Indraneil Mitra and Dr. Badwe to explain to the public and through the press, which misreported. They said it's misreported. They didn't say what was misreported. So that is so people who have scientific breakthroughs don't go to the press. They go to the scientific journal. They will allow a peer review to come through and you get your proper due recognition in a scientific forum, not in the general public or in the media. So most circulations about these sensationalisms actually fool the public and they make a fool. So everybody who now wants to go and take that medicine, stop taking their regular medicine. They're stopped. almost a dozen patients stop taking. We want to go and take that medicine in Tata Memorial Hospital. I believe it is 100 rupees a tablet, so we will take that. Why take all this chemotherapy? All of them will of course die. So it should never be like that, that there is a cure for everything or a test for everything and a treatment for everything. That will not exist.
Yeah, there's no magic bullet in medicine. I think all of us should know that. And as Dr. Nageshwar Reddy mentioned, there are a lot of gaps in our knowledge in medicine. We are as wise as the knowledge we have. And there are so much unknown things we need to discover. And I think we'll have to leave it to you. I think, Madam, you have a question?
We should not take antibiotics
Yes.
after developing cold or cough or anything like that.
Yes.
How is it possible? For a long time it remains, and without taking any medicine, it lives for it holds for a long time, and attending some workplaces or anything. That's also problem. Is there any way to get vaccination for normal cold and cough like that? Nowadays, people are getting very fast those two things. Is there any?
Dr. Sunita, one thing I wanted to add when you're telling itself is that one of the reasons for antibiotic misuse is patient pressure. And here seeing one.
So, if you have cough and cold frequently, lot of times it could be allergic. If you're having recurrent for long duration of time, I was just sneezing sitting over here. I may have a runny nose and a cough or sneezing. That doesn't mean that I have an infection. It just could be allergy. You need to understand what the problem is. And if it is a viral infection, if you have allergies, if you know what you're allergic to, avoid that. If you don't, there are medicines that can be used for allergies. If you have a viral infection, taking antibiotics will not help. There are sometimes you will have bacterial infections causing cough and cold or fever. You need to take antibiotics at that point. But by far, over 90-95% of the time, your regular coughs and colds are viral or non-infectious. Taking antibiotics for that is not going to make any difference for the primary process. It's like when I was a child, I was told that if you take a cough medicine, your దగ్గు జలుబు వస్తే వారం రోజుల్లో తగ్గిపోతుంది, లేకపోతే మందులు వేసుకుంటే 7 రోజులు అవుతుంది. It's the same thing. It's not going to make too much of difference. What will help is preventing spread to other people. If you have an infection, you should not be exposing to other people that are potentially going to develop the infection. Especially in the back old days, we are all exposed to more of open air and clean air. That itself is half the treatment. Now we are going and sitting in this room, here in this room, for example, you're about 70-80 people. If one of us have a cough or a cold, you're going to be spreading to the other people. So our circumstances have changed. Any software company, you're exposing so many other people with your coughs and colds. So you need to be conscious of the fact that you're not going to spread these infections. At least simple things. Wear a mask if you have a problem so that at least you don't spread it when you're going outside.
Infections, do we are having any vaccines like that?
These simple infections help your body's antibody development, so you don't necessarily need to prevent everything. You have to let nature do some of its things.
But we have to suffer, no?
Yeah, like we are
That's part of life.
born on this earth
That's
to suffer.
part of life.
So don't worry about that. So even children, many parents get worried that they're frequently getting cough. That is nature's way of immunizing those kids.
Yeah.
Okay, and you try to suppress it. See, there are many diseases we shouldn't suppress. Actually, that's something we should all understand.
Yep.
Yeah, now nobody removes tonsils anymore, isn't it?
They are no longer advocating removal of appendix also.
Yeah, exactly.
Everybody is going against removal of the appendix. Now we know that probably many cancers in the body, many rheumatological conditions in the body can be prevented if you prevent the removal of the appendix. This is very well known.
So I hope yes, there's some more questions.
what he has talked about. There's an increasing population of the elderly, single men, single women. So how do we make medical care accessible and affordable to such people?
Yeah, that's a very important.
Because they're alone.
Yes. In fact, the government yesterday in the parliament has made an announcement that they are going to have an insurance scheme under the National Health Authority to cover everybody who are 70 years and above, inclusive of pre-existing illnesses. So if that thing comes, that will take care of the health care of the elderly. Even in the United States, older people don't get covered by the insurance or their premiums are phenomenal. But I think the governments have to take action. And many of them, as you said, live alone and there's no...
Problem is with companionship and boredom. That can't be taken care of unless you learn to belong to a group. So we can take care of physical health. Providing them mental health and emotional support is very difficult.
The reason I was asking is that since they are alone, there is no there's no accessibility on time.
No, they are alone and they don't...
So don't try to be alone is the remedy for it.
No, but many children leave their parents.
So that's again a man-made tragedy, social tragedy, nothing to do with... So it is the mother and the father who encourage them to leave you, to seek better life away from this country. So it is our own making.
We need to teach our children value systems.
Yeah.
If we take care of our parents, our children will see
Take
that
care of
and
you.
will learn to take care of us. Half the children now are outside the country and the elderly parents are sitting here struggling. It's up to our generation to teach our children how to take care of our parents.
Yeah.
I think your point is that whatever is discussed is true, but I think you are trying to hit it. What are the approaches possible in these situations? Avoiding situation, teach your children, all these things can be done. In those situations, the government can think of a telephone number or something. If anything, you call particular number, the entire country, and the medical assistance will reach the place. Okay, such things should be planned. Maybe there will be a way of handling it. Okay, absolutely. Why you can teach now the children, but that will be for next generation. All these things can be done. You have to think of a solution for a problem. The problem, if somebody is staying alone, today nowadays everything can be booked online. If you are staying alone, you go to computer, online you book, everything comes. All services also are coming. Like that, why not government think of a number like 911 in US, and where the medical facility will reach the person who is required there. Not just only emergency, any facility should be done. Such things can be thought of. You must be having a boldness to think, not only just comply.
Yeah, there are also wearable devices which elderly can wear.
Wearable devices can communicate to the...
Communicate automatically. The moment they see that their equilibrium is gone, it triggers off an alarm. But many are there. So anyway, we hope that all this will come to support the elderly, because we never ever thought people are going to live long in this country, I think. So now we have got a new problem, so let us find a solution. Now before I conclude, I want to tell you something from my side, is that the ICMR NIN has come out with dietary guidelines. Because all of you are talking about lifestyle, and that tells everything about what to eat, when to eat, how much to eat, exercise, processed foods, everything. You can download it free from the website. This is called Dietary Guidelines for Indians 2024, and please read them. It will help you to have a better lifestyle, not only for yourself, but for your entire family.
I wish all the nutritionists read so that they don't prescribe avocados any longer.
Yes, absolutely. Avocados are not there in that at all. So anyway, thank you all. It has been an enjoyable discussion, and I thank the opportunity I received. And thank you all for patiently being sitting here till quite late in the evening. And I hope this discussion has benefited you. And it's a nice way of, honoring these doctors who are helping the patients on a day-to-day basis. So thank you all, sir.
To all the panel speakers and esteemed doctors present here today, your presence has truly enriched this gathering of medical luminaries, making it exceptionally impactful. Your willingness to share your expertise and insights has contributed immensely to the success of this event, inspiring all those in attendance, and have made this event truly memorable. Thank you once again for your kind presence and commitment. I now request our President Dr. Mohan Rao Garu to present a memento to the Secretary of the Birla Science Center. I also request Dr. Shashikiran Garu to present a memento to Dr. Purushottam, Vice President AISTC. I thank you, Dr. Shashikiran Garu, former Director NN, ICMR, Dr. Mohan Rao Garu, Dr. Raghunath Rao Garu, who is also BC Roy awardee, and Dr. Narasimhan, Dr. N.V. Raidu Garu, Dr. S.B. Vivekananda Rao Garu, EC member of the Birla Trust, and also physician to Birla family. We extend our greetings to the Birla Science Center for holding this event on this memorable day. And Dr. Raidu Garu, Apollo Hospital, he also joined lately. And Dr. Bhushan Raj Garu, he is familiar in the recent, from the last few years in the COVID scenario in all media. And Dr. Sunita Reddy Garu, Dr. Jalil Garu from Kamineni Hospital, Dr. J.L.N. Shastri. We extend our sincere thanks to all the speakers, particularly for the precise execution of this event by Dr. Shashikiran Garu, and for the constant guidance of and insightful initiation of Dr. Mohan Rao Garu in holding these discussions. We gratefully acknowledge the general support of Birla Science Center, particularly V.C. Rao Garu, member of the Executive Board, and Dr. Murchyunjay Reddy Garu, director of the Birla Science Center, and his ably guided team, Shyam Kotari ji, his team, R. Subramanyam, Ravi Raja, and other staff for their invaluable support. I extend my sincere appreciation to Dr. Y. Purushottam, of Vice President of ASTC. Thanks are also due to all the founding members of ASTC, Sri P. Srinivas Rao, Sri Somayajulu, Sri Mahadev, and Sri Kovuri V. Rao for their unwavering dedication and efforts in organizing this event. Our special acknowledgements to all participants from various institutions. All invitees are warmly invited to join for a cup of tea. Thank you.